Start.
We welcome all our friends, members of MSc Medical Service Center, our friends who are supporting us in our fight against COVID, in the fight against epidemics and disasters, and in the fight for right to health for our people. So we welcome all our viewers and friends today to this live seminar, COVID-19 pandemic, the people and health. It is very evident that all people throughout our country, not only our country, all over the world, has been accosted by this sudden and devastating event which is sweeping across continents. In our country, when the first case appeared in 30th of January, still no one was prepared. Still the government was not prepared. We were not even knowing what this thing COVID-19 is. So, on behalf of Medical Service Center, the socio-medical voluntary organization comprising of all people related with health, standing for right of people to health and right of healthcare providers, we first wanted to know what this issue is. So we started organizing seminars at that time in end of January and first week of February. Life was actively going on all over the country. All academic, all professional work was going on. So we started convening seminars, small group discussions, then seminars, big houses, right from the first week of February all across the country. It was physical activity going on at that time. We got specialists on the issue, public health experts, virologists, microbiologists, and other clinical medicine experts, internal medicine and critical care experts to interact upon the findings, because till then the knowledge was evolving. The knowledge was not clear what this COVID-19 is. So we were aware as a profession that we have to face this issue. We have to face that whenever the crisis comes, since it is spreading from one continent to another, our country won't be prepared. Though our government was paying a blank eye to this crisis, we wanted to be prepared. So initially these seminars were there, small discussions in the larger houses. We even organized in public halls. We organized meeting of 200, 300 healthcare providers, doctors, medical students, nurses, nursing students, paramedical staff, and even some conscious citizens in huge seminars in different parts of the country. Then we started, when the COVID issue was coming in and daily guidelines were changing, we started studying together and we started propagating what this issue is. We even made small videos to upgrade local people, the healthcare providers, exactly what to do, what to face, how to don and doff a PPE. Even because PPE was not available, people did not need PPE. And we were repeatedly appealing to the governments, to the Prime Minister and to the local state level chief ministers and even to the local district administration. Please initiate active and passive surveillance. We were emphasizing you, please initiate proper care, early diagnosis, rapidly increase your capacity. Nothing was being done. We sent open letters, memorandum to the Prime Minister, to the chief ministers, to the governors, through the governor, to the PM. Like this we were proceeding. But to no avail. Already by March, services were being crunched. And so when suddenly the lockdown occurred, when people were taken aback, no one was prepared. None of the population, none of the profession was allowed to be prepared. So we even started a phone call system. In some states, Bengal, in parts of Odisha, we could have a very early organized system where regular fixed time 7 p.m. to 9 p.m. people would call, hello doctor, like that. One calling line, 5, 6 lines we opened in different states. Sometimes in local level we did, our volunteers had to coordinate. Our village health professional, health workers, they tried to provide support because no other service was available. So this type of activity we were continuing. Then when the crisis was assuming alarming proportions by April, we called a national protest day. We had a say call for save humanity. Online postering we did, demanding PPE for the healthcare providers, demanding security for the healthcare providers, active and passive surveillance for all, because still then lot of communication was going on. Even up to the end of March, all foreign travel was going on. So we were demanding all these, and we were demanding proper care for the homeless, for people who are moving around, for the needy and poor people. These demands we raised on 27th April from 8 a.m. to 12 a.m. We had a 4-hour online postering in all social platforms, in Facebook, in WhatsApp, in Twitter, like that, all over the country. Almost 15 states participated in this online postering. But since it was the first time, only our mainly activists they participated. Not many of the other people, non-medical, non-MSc professionals participated. Then what we did on 12th May, which was the bicentenary of Florence Nightingale, the founder of modern nursing. It is an international day. It is the 200 years of Florence Nightingale, this 12th May. So we organized an International Solidarity Day in the fight against COVID. All frontline workers, the 27th April, we had called only healthcare providers. This time we called for solidarity in fight against COVID to protect all frontline workers and prevent COVID spread, and again enhance early diagnosis treatment and uphold right health for all. It is not insurance, not coverage, health for all. So this we could do over the months. When lockdown was clamped in, we could not proceed further, but online interaction we started. Many of our state committees, they organized many issues on COVID and other medical issues on medical ethics and medical science. Lot of interactive sessions we did. So today, I am very happy that we have with us Dr. Tarun Mondal. Dr. Tarun Mondal is our Vice President. He is known all over the country. He is one of the founding pioneer figures of junior doctors movement from Bengal in the 80s. Then he is a figure in public health movement throughout the country, and even he was a member of the Parliamentary Standing Committee on Health and Family Welfare from 2011 to 2015. He was in the Parliament and in the Parliamentary Standing Committee for Health and Family Welfare. He has worked with the healthcare planners, with our national planners from the point of view of the people. So we are so happy we have Dr. Tarun Mondal over here. He will be putting forward the point. The point is today of discussion: COVID pandemic, COVID-19 pandemic, the people and health. So health not only from the medical point of view, but from the people's point of view. Our Central Committee member, Dr. Mridul Sarkar, he will be conducting the session and he will be guiding the interview. We have got points coming in from different states across the country. From at least 8 to 10 states, they have written in their points. So their points will be put forward, the questions will be put forward. I hand over the session to Dr. Mridul Sarkar, member of Central Committee of Medical Service Center, and Dr. Tarun Mondal, who will be conducting our seminar today. Welcome, Dr. Mridul Sarkar and Dr. Tarun Mondal.
Dear friends and viewers, you have already heard that Dr. Tarun Mondal, our Vice President and the former member of Parliamentary Standing Committee for Health and Welfare, is with us in this discussion. Now, when we are discussing about this COVID-19 pandemic, the situation of COVID-19 pandemic has been reached in such a horrible situation that almost more than 200 countries all over the world has been affected, including all the European countries, and the most powerful countries of the world like America has been affected by this viral pandemic. And more than 1 crore 20 lakh people have been affected, and more than 5.5 lakhs people have been succumbed to death. And in this situation, we all know that this viral pandemic has been due to an unknown viral infection. And many of the people are saying that as this viral infection is unknown to us, the this situation is inevitable, and when human civilization has been is facing such type of pandemic, there is nothing in our hand to resist it. So this catastrophe is inevitable. So my question to Dr. Mondal is that, uh, was it inevitable? Was there any way out to resist it, to contain this catastrophic pandemic? This is my first question to Dr. Mondal. Please, Dr. Mondal.
Thank you, Dr. Shankar, and good evening to our listeners and viewers of this very pertinent discussions of today regarding this COVID pandemic and people's health, particularly concerning to our country. Point is, in India also, already more than 106 medical doctors and health personnel succumb to death, and regularly around 25,000 are newly infected. So certainly the question is very serious. But we are dealing in the second decade of the 21st century, where science has advanced too far. We have got tremendous knowledge on viruses, on bacteria, on other things of the world. We have got technical know-how, sophisticated instruments, research materials in the molecular biology levels. And corona is also known to us, though it is novel, this particular type of corona is novel, but already four of the same genre was within the human populations, particularly our regular cough and cold, etc., are being mainly done by corona, another group. And how to fight with the virus, how to contain a infective disease, how to protect our healthcare workers, starting from doctors to ground level healthcare workers, how to bring out a new medicines or vaccines. The world is acquainted with it. This is not new that it is a new disaster the world is facing first. We have seen plague. The human civilization has seen Spanish flu, which have taken over more than 5 crores of people. Cholera, smallpox. Smallpox is already eradicated. And many of the killer and disabling diseases human civilization has been able to contain with newer armaments in the armory of medical science and health science also. But the point is, newer researchers, research institutions, and the proper funding what is necessary to deal with such emerging diseases or a new brand of virus or bacteria, that is not being done in the world nowadays, starting from US to China to Japan to India, because the health system presently is mainly guided for the profit motive. Our research or health service, healthcare service is not guided or directed for the interest of the people. It is not people oriented. It is practically commerce oriented, profit motive. So mainly the vaccines, etc., you are seeing in this case of corona also, that is being done by the private companies, corporates. The states are not directly sponsoring the things. Here is the lacking. Suppose if there was the erstwhile socialist system today in the world prevailed like the earlier USSR, which contributed a huge amount of fund in this sector of medical research and scientific research, cultivation of science, for inculcations of vaccines or bringing out new medicines to fight out any epidemics, the picture would have been different. We have seen in the previous century that was the ruling socialistic state, socialized medicine system, whichever of the countries followed that time, and they could take proper responsibility of healthcare, both preventive, promotive, curative, and rehabilitative of the entire populations by the state, its own responsibility. That is also being not taken up by the so much rich countries, including US. You must be knowing that in US also the question came in the parliament that even the common 40% of US population cannot spend on an emergency $400. And the question was raised by many experts that the vaccine which is being generated over there, that should be given free of cost. But the speaker in the house told it would be of moderate price, not free of cost. So that is the phenomenon. Second point is the this emerging disease which has been called pandemic by WHO, World Health Organization, it was taken lightly and not seriously by any of the countries in the world. First of all, I should make China responsible because it did not give proper warning in proper time. It tried to conceal it. Even Dr. Lee, who was treating such kinds of patients in last November, December, and tried to bring it to the notice of the government, it was not paid heed properly. Finally, Dr. Lee also died during treatment of other patients with corona. And the business, Wuhan, the particular city of Hubei Pradesh, where it was erupted, the business, the travel with all over the world, it was being continued by China. The peculiarity of the thing is that China cut down its all doors to all other cities of China with Wuhan, but it did not stop flights and other things, ships, etc., to Wuhan from the rest of the world. So it was, I should say, it was it is an offense to the world and to the world populations that a pandemic, which is a matter of huge emergency, that should be brought into proper notice in time to World Health Organization and to rest of the world. But it was coming into the newspapers and journals, and you see, starting from European countries to US and to the rest of the part of the world, including India, they did not also take care to this dangerous, I should say, so severely infective and emerging novel virus. And for that reason, even in America, the American president told to his people that don't worry, it will be controlled easily like magic. In Italy, which has been worst hit, in Europe, that also by their administrator, by their prime ministers and others, state leaders, they also did not took it seriously in the first time. So whatever measures should have been taken by these countries also, they did not do it only to protect the business motive and to save their economy. What China did, the rest of the world also did. But it was not to practically protect the health of the people, not only of their respective countries, but the world over. They rather tried to protect the interest of the business people, of their businessmen, of their corporates, so did not check travel or she did not stop with business with China, Wuhan city. I suppose if these things could have been done properly and in proper time, and a system like a socialistic system of erstwhile Soviet Union would have been there in the world, such kinds of catastrophe, maybe it's a very severe pandemic of coronavirus, it would not happen to the world. We could definitely prevent it, I suppose.
Okay, thank you, Dr. Mondal. Now, coming to our country. In our country, we are really worried about the worsening situation of this pandemic. In our country, daily infected persons has been crossed to over 25,000, and total number of positive cases has been reached to 7.5 lakhs, and more than 20,000 people have been succumbed to death. And in this situation, our government, they are saying that they have done everything. they are saying that they have taken all measures to contain this pandemic, and they enforced the lockdown for more than 3 months, and now we are passing through a period of unlocking, but the situation is worsening day by day. So my question, Dr. Mondal, is that if government have been taking every measures and according to their campaign, if they have done everything, then why in our country we have reached in such a horrible condition with this pandemic?
It's correct. My point is, like other countries, I have told you in my first point that government of India also did not took proper measure in proper time. See, 13th of March, the Health Minister Dr. Harshavardhan, government of India, told to our people, Indian people, that in India there is no health emergency. When practically rest of the world, the European countries and other countries, after their first lapses, are trying to take strict measures, including lockdown in different countries. Then rather Indian government was busy with welcoming the American President Donald Trump and for his felicitation arrangement. You could recall that Indian government also that time, rather the ruling dispensation was busy for the MP government for manipulating or horse trading of taking other political people in their own fold. And they were running the parliament also till 24th of March. And also they are doing some vilifying campaign against some particular religion, particularly Muslim religions, only to drag our eyes and to implement rather forcefully their NRC and CAA, such kinds of act which has been passed in the parliament. If lockdown is not a measure to cure corona or to contain any sort of virus. Lockdown for any country is a measure to give a space, a time to any country to overhaul, to boost its health system, so that when the attack will come, when the peak of the infection will come, its own health system with increased health structure, infrastructures, medical manpower, kits, medical laboratories, quarantine system, isolation facilities, with so many things, ventilators, oxygen supply, with so many things, they could rather fight out the infection when it will be coming to its peak, and the system will not be overwhelmed by the brunt of the disease. Did India do anything in these regards? You will agree with me, at different parts of the country, the frontline warriors, the medical community, the nursing community, the laboratory technicians, including the ASHA workers, including the non-registered medical workers, I mean the informal healthcare providers, ICDS people, Anganwadi people, all kinds of people were worried for want of PPE, personal protective equipment. There is a lack of testing kits, and lack of laboratories also. India till 31st of January could make 117 labs only. And after increment also, at the end of February, it could go up to 151 labs. And governmental increment was only 9 labs. And what should have been done, that has been done by countries like Singapore, countries like, Sweden, countries like Germany to a good extent. Maximum testing of people, that has not been done in India. They have claimed lockdown, but the ratio, you understand, the ratio in India of testing it's so shabby. It is only 3.8, I think, per thousand people in India. Whereas, if I compare with the rest of the world, if I compare it with the rest of the world, in Russia it is around 95 per thousand population. In US, it is 66 per population, thousand populations. In UK, United Kingdom, England, it is around 54 per thousand population. So, which is a main thrust should have been given during lockdown, and the quarantine system. See, in India, 40% of our population do not have a second room in his house of a family of 5 persons. 46.9% of our populations do not have an access of a latrine, a toilet in their own premises. Around 43.5% of our populations do not have the access of tap water. So India, this washing of hands time and again, and to make a safe distance of 6 feet, that's even it's a luxury. And you can understand, even for the interest of some particular commercial group, the government of India cancelled the order given by National Institute of Virology, Pune, for supply of kits. Rather, India, till the end of February, supplied 90 tons of gloves, masks, and other PPE materials to Serbia. And not giving attention to this severe pandemic, rather he was purchasing light machine guns 1600 with rupees 880 crores from Israel. Such was his business. And what I was telling you, that instead of giving priority to National Institute of Virology, the order was given to Kashara Diagnostic, owned by an industrialist very close to our Prime Minister, that was Kartikeya Sarabhai of Gujarat, to bring out these testing kits. And who was this Kartikeya Sarabhai? Kartikeya Sarabhai, we all know by this time, that who arranged the felicitations of Donald Trump, President of US, in Ahmedabad, and give much presentations on behalf of the government, show there was a failure in testing of labs. The ICU, the beds, is horrible in India. Totality 95,000 beds are there, 80,000 in the private sectors. Our bed ratio to population is pathetic. Only we had 7.3 bed per thousand populations, where World Health Organization recommendation is 3 beds minimum per thousand populations. And coming to the numbers of ventilators we are having, probably India is having 80,000 ventilators, but to a rough estimate, India needs around 2 lakhs minimum ventilators. So these kinds of things, you understand, was really necessary during that period of lockdown. But actually, government of India didn't do nothing, didn't do anything. And the worst kind of thing what Indian government did, that with the migrant workers, that was coming out from, as suddenly lockdown was clamped down on the nations, they were puzzled how they will come back to their respective states. There were no traveling arrangement, no food, no shelter. They were huddled, they were shelterless. And even after a few weeks, when traveling was arrangement for them, it was in an inhuman manner. And that helped to spread coronavirus among, not only among the migrant laborers and their families, but within the community also, when they entered into the community. Neither government of India stopped international flights in due time, neither it managed to get quarantine centers, neither it build up proper isolation centers. Any new hospitals were not built. In China also, we have seen that new hospitals, thousands of beds hospitals are built up. So such is the situation we are facing now today. And we do not know where and how India will be able to tackle the fierce attack which is appearing and which is picking up gradually. Indian government did not took the proper measures which should have been taken. If it should have been taken in time and in a proper way, I believe that such kinds of catastrophe and such massive infection, including community infection, whether the government admits it or not, would not happen. That is my belief.
Our Prime Minister announced that to boost up the morals of the people, they announced that ringing of bells and lighting of lamps, etc., etc. They have announced. Regarding this, what you will say?
See what the scientific world is thinking over. The scientific measures should have been taken by the health department, by Prime Minister, by every state. But ringing of bells, beating drums or cans, or taking cow urines, or Patanjali's medicines like coronil or sambatika will not help to contain or cure corona. That is clear. Whatever countries which have got success in the world and whatever success even India could achieve, whatever maybe its rather lacunae and lackings, that has been done by our frontline warriors, by applying medical science, by applies the laws of bacteriology, virology, epidemiology, and public health specialists, including the work of the clinicians and the people who cooperated the government to implement its sort of program to contain this coronavirus. Such kinds of superstition should be totally stopped. Our people should be free from any kinds of superstitions, and I should say that the things evidence based should be only inculcated in India, not only in medical world, in scientific world, on any part of life. So this is a necessity, I believe.
Now, one very important point is coming, that to contain this pandemic, a strong pro-people health infrastructure is very much necessary. And to build up this pro-people health infrastructure, we need more budget allocation and a appropriate health policy is needed. And my question to Dr. Mondal is that in our health system, in our country, the health policy and budget allocation, is it appropriate? Do you think that it is appropriate to contain these types of pandemic?
Dr. Midul, I should say you that at the end of the day, to get the outcome of the health, the thing matters how much a government is spending for health. Rather, how robust and resilient is the health system, national health system, or public health service of any government. You see, till the time of socialistic health bloc in the world and the slogan of health for all by 2000 AD that was practiced, and the first national health policy, it was done by our government in the year 1983. Till that time, there was a push and and rather I should say the recommendations of different health committees in India to increase the GDP percentage for health and spending for health from the national exchequer. But gradually, after the world took over this world under the World Trade Organizations, under the dictate of Gates, that liberalization policy, privatization policy, policy of commercializations that engulfed not only the economic system of every country, But all the welfare sectors, the public service sectors like health, like education, like electricity, like water supply, like transports, such kinds of things are being taken up from the fold of the governments to the private players, private owners. And particularly since 1991 in India, when this new economic policy and liberalizations policy was followed, and especially after the year 2005, practically government of India did not boost up its health infrastructure, starting from primary healthcare service, secondary level to tertiary level. Whatever had been increased, that has been increased either in the private sector or in the PPP model, public-private sector model. It was necessary by government of India to take the responsibility of the health of the people, to announce it as a fundamental right of the people, and should do free health service to every citizens of India through its institutions. It should boost up its preventive setup, practically in the name of NHM, NRHM, NHM, and taken up different policies in different times. It has destroyed the health system, whatever have been made in India till you can say mid 70s. And totally the focus has been changed health to treat it as a commodity. And it has been taken into under the Consumers Protection Act. If you have money, you can buy health. If you don't have money, you do not have any access to proper health care. That has become the situation. 1.31% is the GDP now presently India government is spending for its health service. To a maximum extent, 30% spending is being done by government of India for health care service delivery system of Indian populations. Whereas till today, US spends 44%, Canada spends 84%, UK spends 84.5%, Sweden spends nearly 84%. Even most of the third world countries and our neighbors spends in the spending ratio more than the Indian government. So unless your health infrastructure is robust, starting from your preventive measures to promotive measures to curative extent and rehabilitative infrastructures, see the hell of with the non-COVID patients, you can understand. The number of patients dying with corona, far more number of patients are being dying by heart diseases, by COPDs, asthmas, diabetes, cancers. Chemotherapy has been stopped. General surgeries has been stopped. Immunization deficiency by 70%. UNICEF and other organizations are putting pressure on India. What will be in the long-term results of it? TB sputum examinations had been reduced 33%, Malaria testing had been reduced nearly 33%. So such a country we are living. And here, particularly in the drug sector also you see, the earlier concept of that Hathi committee, that there should be nationalized drug companies, sectors like our public sector undertaking, that has been closed rather. Hindustan Antibiotic Limiteds, IDPLs, totally taken off by the private sector. Vaccines, instead of our Kashuli centers or our National Institute of Virology, Pune, government of India is importing vaccines from different countries with expending huge dollars from our exchequers. That should have not been the case if proper attention would have been given to our health structure, to building up and to make it free of service. Our universal health coverage, this Ayushman Bharat and insurance-based policies taken up by government of India, particularly after this liberalization, commercialization policy, is not conducive to fundamental health right of any people. 97% of the premium income has been taken up by the private insurers. You know what the insurers, how many percentage have got benefits? It is only 6.6%. You know, 80% of the money of reimbursement from this so-called Ayushman Bharat has gone to the coffers of private players, not to the government institutions. So question is, unless health is seen or taken or treated as a fundamental responsibility of the state, what Dr. Norman Bethune, Frederick John Banting seen that time in USSR when they went to attend a international conference over there, and they were overwhelmed by the systems, every care for every individuals of United States of uh, Soviet Union, USSR. Even today in Cuba, whatever system, socialist system they are following, all the parameters laid down by World Health Organizations, they are fulfilling. Can you imagine such a tiny country of nearly 1 crore people has produced more than 1 lakh medical doctors, more than 4.5 lakhs other health professionals. They are serving in the world more than 160 countries. In this catastrophe in Italy, Europe, also they sent 43 doctors with medical appliances. It is possible in a socialistic system. You understand? If not socialistic, even what is being done by other countries and putting an approach, a pro-people approach, spending more. In this scenario, now even the economists and different sectors also has raised their voice that some money should be put up for the health sector in India by the economist itself. 15,000 crores announced by Prime Minister it would be put in the government. Still our doctors are not getting PPEs. We are not being able to test our people for COVID. We are not being able to make new ICCUs, Liverside ICCUs, CCUs, simple hospitals beds. Who knows? The situation may come like Italy that we have to triage among peoples who will be suffering with corona that it will surely die, so you don't admit him. It may live, so you admit. India may land in such situation. So country's basic health structures, its health policy, its budgeting, its productions of appliances, not only PPs, other things, and particularly I should emphasize on research. This research is totally in India is depending on corporate money, companies' money. Less than 1% of health spending is being spent for research purpose. Why? To tackle such epidemics, newer disease outbreaks, and to give proper facilities to the people. If I consider in a pro-people manner, the health is the wealth of the country, and our working force should be saved from any sort of onslaughts, say infective, non-infective, lifestyle diseases. Such kinds of researchers are absolutely necessary. Where we are a failure. So, Dr. Sarkar, I should say that basic health structure of a country with its outlook and attitude and policies is very important in emergency time, even in rather the time of peace, in a cool time or a stable time. This is very important, where India is severely lacking.
You have already mentioned that our frontline health workers are not getting proper PPE, and it is totally correct. And we are observing that all over the country, doctor, nurses, and health workers they are not getting proper PPE, and they are compelling. They have been compelled to work in the COVID hospitals, and in many states, these health workers they have been aggrieved, and they come to the street to protest to in demand of proper PP. What you are saying about this in different states?
It is a very sorry phenomenon, I should say. Our frontline warriors, despite getting proper PPEs, personal protective equipment, from their social responsibility and the dictates of medical ethics by our pioneers like Florence Nightingale, like Dr. Dwarkanath Kotlis, like Louis Pasteur, like so many brilliant peoples of the past from where we are still teaching and learning what is medical ethics, what is people's responsibility, you understand? India, government of India, I have told you earlier, when it should be stopped to export PPEs, they did not stop it. And during regarding that laboratory test kits, I have told you, cancelling the orders of National Institute of Virology, they have given to a rather favored industrialist house of the Prime Minister itself, Gujarat. And in his own state, in Gujarat, the High Court came in to interfere and to tell the Gujarat government they should rather supply standard proper material to shape the population for their testing, cure and treatment, isolation, etc. Such is the sorry state of affairs in India. In Hyderabad, in middle of June, 300 or more doctors of Gandhi Hospital was protesting. They were very agitated and was not ready to resume the COVID duties because lack of their proper PPs. Dr. Rajkumar Srivastav in AIMS All India, which is a premier institute in India, who raised a question before the authority that even the senior doctors are not timely visiting. The entire load of the corona control measures has been put off on the residents, junior doctors, interns, and such is the state not only in All India Institute of India, but also in different corners of India. It is also very bad. As because Dr. Srivastav raised the questions, the authority came down heavily on him. I was saw last 2 days back in some news media that the junior doctors of Karnataka was shouting in a sit-in demonstration that they have been not paid 16 months of their salary. Dr. Sarkar, I should ask you whether such people in such an emergency time should get such an inhuman, cruel, irregular, irrational behavior for any government. 500 nurses, as because their employers, the private sector, could not ensure their safety, security, and employment, they had to leave Calcutta. You must be knowing about it. Our medical students, the government was dictating them to bring into service. And I know your students' organizations protested against it and formed a movement. Even with the ministers, meeting with the chief minister of Bengal, you protested personally. You were present over there, as far as I can remember. They are not equipped. They are not trained for that. Rather, their training, their practical training, their clinical training has been stopped. And we are listening, as per dictates of the Medical Council of India, these students all over India will be taken exams on a virtual manner and they will be promoted to the upper class. What kinds of doctors our future is going to get, our populations? Will be the properly trained doctor? So attention to proper healthcare workers, particularly frontline healthcare workers. Indian population, around 70% of population is being now taken guard by the non-registered medical practitioners. I mean, informal healthcare providers. They wanted some PPs. They wanted some training, some precautionary measures by the government. They refused it. They did not pay heed to it. The nurses unity, one of the organizations, I have seen very vocal. Our working sisters, sister in charges, they have been died also. We must pay homage to them. to these frontline warriors. The government should pay out to them. So these lacunae or lackings are very much there. Recently, in so many medical colleges, the junior doctors, residents, they have raised a point that senior doctors, most of the senior doctors, they are rather trying to avoid the duties of COVID duty, corona duty. That should not be. From our medical ethics, from the social responsibility, like many frontline warriors, every medical community fellow should come forward in this hour of crisis of the people. If the government can desert them, but the real ethical, social, and moral medical manpower, health manpower cannot desert its populations. It is against humanity. It is against the rules of mankind. So we must ponder over for this problem. We must appeal to the government who are on the helms of affairs, at least to earn its warriors with the proper armament, so that the days which are coming would be more fearful and they can fight at least properly with this menace of COVID 19, I should say.
One important thing you have already discussed, and I like to put it again, that you have said that the countries, small countries like Cuba, Vietnam, and having a socialist health infrastructure, they are better performed, and they are successful in containing the COVID pandemic. So, are you saying that only socialist health system is capable of containing this pandemic?
This is a very good question, a provoking question, I should say. That is the ultimate reply, I should say, because till today, what history have witnessed, socialistic system of healthcare is still today is the supreme. Even in our medical textbooks, our textbooks of preventive and social medicine, it has been categorically written. In that golden time of USSR, just after their October revolutions in the year 2018, the great revolutionary Lenin made a decree, declared, and told that health of every citizens of USSR will be the responsibility of the state. And not only on severe or serious diseases, on the public health problems, on typhus, on lice, and so many other things that Lenin that time told for the problem of lice in USSR. Whether lice will defeat socialism or socialism will defeat lice. By the time of mid-30s, under the reconstructions of socialism, under the leadership of Joseph Stalin, Molotov, Voroshilov, A.N. Gorky, the world has seen that they were nearly surpassing the best of health services and the infrastructures in the Western world. In her book, Soviet Union Today, one of the British reporter told she visited in 1951 Soviet Union, and she narrated the health educations water, sanitation, on every aspects of healthcare services. Such was their structure. Nearly per 200 people they had got to achieve one doctor. They could make per 50 persons one nurse. Can you imagine in 1972 only, Soviet Union could achieve 4,80,000 medical doctors for only around 30 crores of people in Soviet Union. And it was so huge infrastructures they build up and health services they build up. Every institutions of Soviet Union was for every citizens, from their primary health care center to any tertiary center. That was the responsibility that state took that time. Even today in the world, I have told already, Cuba, what they are following, they are showing best parameters in health standards, even surpassing many European rich countries and even in US, United States of America. So to contain this corona menace, even those countries, not a socialist country, but at least followed pro-people scientific policies, like I should say Sweden, Iceland, New Zealand, to a good extent, Germany. You see, Singapore, Taiwan, our neighboring country, Sri Lanka, at least they did not boast on the empty promises and knowledges of their state leaders. They rather depend on their public health experts, epidemiologists, their medical associations, on their scientific knowledge. They did the basic very things of quarantine, isolation, tracing, tracking, treatment. They increased their boosted their health services, had taken full responsibility of the country's population. For that reason, they had become successful. I mean, so what you are meaning, yes, a socialistic system of health under a planned central economic system, taking full responsibility of free health service should be the model. But till that time, every nation, every civilized country, every civilized state should take responsibility of health care of its population, should increase health budget, should take should build up proper infrastructures. In that way only, these countries also got success, and even our country also can get success. That I fully believe and mean.
Um, for a long time, our discussion is going on, and now we have reached in our concluding part of the discussion. Uh, you have discussed and placed your invaluable opinion regarding the COVID-19 pandemic, the role of the government, and the condition of our people and frontline health workers. And now, in our concluding part of discussion, um, my question to Dr. Mondal is that in this condition, what should be done? What government should take the measures to contain this pandemic? And what is your message to the people and to the health workers in this critical juncture of this pandemic?
Really, it's a critical juncture, and I like to comments rather to tackle or to pass over this pandemic in a very
sorry for interruption. Due to some technical problems, we have been compelled to interrupt our discussion. Now we are again starting. Uh, we have come to the concluding part of our discussion. In this concluding part, uh, I placed my questions to Dr. Mondal that you have discussed and you have placed your invaluable opinion regarding the COVID-19 pandemic and the role of the government, the condition of the people, and the frontline health workers. Now, my question is that what should be done now? What measures should be taken by the government, and what is your message to the common people and the frontline health workers in this critical juncture of this pandemic?
Really, we have reached to a very critical juncture of corona pandemic concerning to our country and our people. I like to divide this responsibility to three categories. First of all, I will like to start rather with the responsibility of the medical community. I being a medical person, I being a part of the healthcare providers or healthcare workers. This is our moral, social, and ethical responsibility to stand by the people during any sort of their disasters, any sort of their danger or problems, sufferings. Whatever may be the shortcomings, lacunae, and difficulties from the part of the government and administrations, we must stand by the people, definitely taking all necessary guards, precautionary measures. So on the one hand, we have to live by from all scientific knowledge with COVID or with corona, with how many months in the future, if not say how many years, we cannot say right now. So we have to anyway live with corona. So the minimum precautionary measures to put up a mask, a proper mask, to maintain a proper physical distance of 6 feet or 2 meters, and to use soap water or sanitizer. These are the three basic things of our protection from this rather dreaded virus. Though not vaccine is yet on board to use this immediately or today, but havoc work is going on all over the country and all over the world. But unscientific, irrational, like political diktats to complete the work of vaccinations or trials, clinical trials up to phase 3 within 15th of August, and to start vaccination of our population by 15th of August has been severely criticized, rather condemned by the scientific world, irrespective of India or abroad. That cannot be said. It is not simple drum beating or ringing your bells. Clinical trials of vaccines is a specific scientific measures. Unless we could assure the safety, security, efficiency, immunogenicity, and tolerability of the particular vaccine, we cannot prescribe it for any sort of population. So that should be definitely done. The previous ICMR Secretary and Director General Shaminathan, Shomya Shaminathan is now the chief scientist of World Health Organizations, from India. And she has also criticized extensively the approach shown by apex body like ICMR in this respects. Let it come. But till that time, that has been marketed by many companies also. All experts, clinicians, all are telling these are on experimental basis. Whether we use HCQ, hydroxychloroquine, or in the late stage dexamethasone to curtail or reduce the mortality rate of severely ill patients. These are also rather in experimental stage. So these preliminary precautionary measures, preventive measures, not to be infected by vaccines, coronavirus, should be our basic approach. And here, starting from our ASHA worker, ICDS workers, informal healthcare providers, the Ayush doctors, I should say, they are being utilized and used rather without proper government order. Many of these health workers, including Ayush peoples, without proper allowances, payments, salaries, without giving them proper PPEs, that should be stopped. They should be taken on board, giving them proper precautionary guards to fight out this menace altogether with their other counterparts in this fight against COVID. So these people who are taking responsibility, this is a matter of pride that they are coming up to discharge their responsibility in this hour of crisis. So that should be our responsibility. Yes, as our organization do, medical service center do, our many other organizations do, pro-people organizations do, service organizations do, we must demand to the government what is necessary properly to fight such kinds of viral pandemic or any sort of disease outbreak democratically in a proper way to the government. And any sensitive government, any pro-people government who is minimally responsible to its people must respond to the demands of this emergency service people, I believe. So this is as per regards of the medical community and health community. Second, there is a responsibility of the people itself. I first of all appeal to them, they should not evacuate or behave inimically to any health worker, any doctor, any nurse who is living, residing in his community. Rather, they should appraise them, appreciate them, reward them. They are fighting, taking all risks of their lives and their families to save population, to save our people only. And strict measures should also be implemented by administrations and the governments to protect, to secure our these frontline warriors. If most of our frontline warriors is infected, they are rather scared to give their service. It will be unfortunate. It will be very sad situations if such is created, if due to inattention or indifference of the administrations and the government. And people should also coming shoulder to shoulder with this health community, medical community, they should build up real health movement to compel the government to pull them down to earth and to supply the armaments, the medicines, the ventilators, the PPEs, to increase the workforce, to increase beds, etc. If only the people associated with the medical community can lose this fight against the government for the benefit of the people, not for any personal interest, then only we can win this fight also in the field with the government. Government must abandon all the punitive measures taken by against any doctor, any nurse, any medical manpower. Think of the condition of Dr. Kafil Khan, who is still rotting in the jails of, I think, Mathura. What he did, he wanted to give oxygen to the moribund children of our country was being suffocated over lack of oxygen. That was his fault. Dr. Sudhakar of Tamil Nadu, how the police and administration is behaving with him inhumanly, beating him on the streets because he demanded proper PPE only, nothing else. Rajkumar, I have taken his name previously, of AIMS, Srivastav, and so many doctors in other places. Doctors of Calcutta also fighting, North Bengal also fighting, doctors of Karnataka fighting, doctors of Orissa fighting, doctors of Haryana, Delhi fighting. Delhi doctors put up black ribbons to get proper PPEs and to get favorable policies from the government. So what the government did not do till today, in India, officially the lockdown is still up to 31st July, you know, Dr. Sarkar. And government is rather unlocking as a paradox when the number of infections and the death toll is increasing. But I should not say as a scientific or medical person that lockdown or re-employment of lockdown would be the answer, because already the community spread has occurred. So if the government, what it had not given earlier during the days of lockdown since 25th, to increase quarantine center, isolation center, hospital beds and appliances like ventilators, oxygens, testing labs, kits, etc. If they could increase in a proper way for all states, including budget allocations, that hopes of 20 lakhs crores that has been allotted, some people demanded that some portion should have been given for the health sector. But we know only 1.5 lakhs to 2 lakhs maximum in cash that can be allotted to the people of India. So definitely fund is a necessity, and that should be immediately borne by the government to disperse for containing this corona pandemic and to give benefit to its fighters, and finally to protect the health of Indian populations. That should be the cry of the day, and that should be the responsibility of the government in one hand, and on the other sides by the medical community, health community, and by the people. If we see this pandemic in this scientific outlook and in such a way, I believe, and I hope Medical Service Center will also agree with me, with its rich knowledge of treating disasters and fighting during the time of any sorts of sufferings to the people, Indian people, we can also contain this dreaded menace. That is my view regarding this point of present duties and responsibilities of medical community, government, and the people.
Thank you, Dr. Tarun Mondal. We are at the end of our discussion. On behalf of Medical Service Center Central Committee, this online discussion has been organized, and from the discussion of Dr. Tarun Mondal, we have got an scientific approach to analyze this situation, to realize our task and duties. Medical Service Center is always engaged to make aware the people, make aware of the health workers, and where needed, health movement is continuously being organized, and we will be always with the toiling people. With this, I conclude this discussion. Thank you.